if you had chosen some clinic which does only FUE, in case they don't do the numbers but take money from you, you lose your money. So in either condition, you are the loser. Not just cheated, it can ruin your life.
Exactly.
Now
Yes.
suppose all the clinics which you connected, they told you about FUE and we can do that. They told you big numbers. But already we saw the donor area was getting empty because of the previous surgery. Now if we do all the grafts by FUE alone, it is not possible. It is going to destroy the donor.
Ugly. Yeah,
But yes, if you take full doses of medicine which can actually cover up everything, you don't realize. And what dose of medicine we have suggested you?
Finasteride
Twice a week. So it is not daily. So 7 mg per week versus 2 mg per week. There is a huge difference. So less dose means more safety.
But actually that dose I am not sure about. Dr. Prerna told me.
But that is,
yes, around twice.
That is the dose which we have given. So if you take that dose, it will help you to sustain the existing hair. It will also help you to protect your health. So that is important. Understood?
Yes.
So I think if you had chosen some clinic which does only FUE, we won't be able to take out that many grafts, which we actually did. Secondly, your donor is now safe. You will end up with a very thin line at the back, at the donor side, the stitch line, and that otherwise the density will remain more or less the same.
Yes.
We did small number with FUE. Did we touch beard?
No, sir.
So beard was not needed. But see, how many grafts did we get from the strip? Strip.
1800.
But more came, I think.
More came, yeah.
2400, 2500.
You told me that it would be around 1800, but actually it came out 25 or 24.
So in the strip, actually, we give you numbers which sort of, conservative numbers.
Yeah.
But usually more numbers come, usually. Although we don't promise, but it can. So especially in a repair case, when already grafts have been extracted from the same site, it becomes difficult to even exactly tell the numbers.
Yes.
So we always tell the numbers on lower side. If we end up getting more, it is a bonus.
It is good. Yeah.
But what we promise, we deliver. So that is why we promise on the lower side. So you got 450 from this and around 700 extra from the strip. So that is why your number exceeded and you got around 850 grafts extra.
Extra, yes.
Understood?
Yeah.
So it was a long surgery. Now imagine if we won't have done FUT, then out of that 2500 area, total FUT, you would have got maybe 500, 600, 800, 700 max.
Yeah.
So, remaining grafts, for that we would have done over harvestation from the remaining area. You understand?
Yes.
So that is the role of FUT. Role of medicine also is important. Now, people who are telling you 4,000, 5,000 grafts, they are never going to do these numbers because FUE alone in the second repair surgery after first FUE cannot fetch you that number. Cannot. So that number is achieved through medicine only, where you take the medicine, you take the risk, full doses of medicine, but doctor is able to justify the over-promised numbers through the medicine at the cost of health of the patient. Medicine, we discussed how medicine can improve the things.
Yes.
You saw that.
Yeah.
So only medicine result can also be that big, that big that it covers up, it gives you even more density at times than the actual transplant.
Yes, sir.
So that is why people are tricked. They don't know. They think that it is the surgeon's skill and the number of grafts, but 90% result is mostly achieved through medicine. So in your case, we have done 80% transplant and we are using medicine as a support just 20%. But if you take full dose of medicine, then the equation is reversed. Then it is 80% medicine, 20% transplant. But you will find clinics who are telling you 4,000 to 5,000 grafts, and that too with full dose of medicine.
Yes.
So that imagine you lose your health, you lose your donor, because in case they do the numbers which they promised, you lose your donor. In
Yeah,
case
loser is gone.
in case they don't do the numbers but take money from you, you lose your money. So in either condition you are the loser. Okay, so your donor is gone, your health is gone, and eventually you end up having something which is highly unnatural. So that is why this actual information, the truth, saves you, isn't it? It saves you. It saves you from so many problems that could have happened.
Yeah, at least from being cheated.
Not just cheated, it can ruin your life.
Exactly. Yeah.